When people hear that hyperbaric is being used off-label, they often have an assumption that that means that it's either experimental or even potentially unsafe. But in reality, off-label use is a very normal part of practicing medicine. So in today's dive, we're going to discuss what off-label use even means, and is it appropriate? When is it appropriate? And how do we use our clinical judgment to make sure that we are being safe and effective with the recommendations that we make? I'm Dr. Jason Saunders, and I've been utilizing hyperbaric oxygen for over 20 years inside my clinic with thousands of patients on both on-label and off-label indications. And in that time, we've seen incredible results, both on-label and off-label, for so many patients who are struggling to find the answers that they're looking for, struggling to reach the levels of health that they deserve. And hyperbaric oxygen was one of the most important things that they added to regain the levels of health that they were looking for. So let's talk a little bit about on-label and off-label. First of all, what does on-label mean? On-label means that the FDA has approved this device, this therapy, this drug for a particular usage. Essentially, it's permission to market this therapy is a direct treatment or cure for this particular disease and illness. Inside this process of on-label, first of all, that therapy needs to be deemed safe. A number of experiments need to be repeated to make sure that this therapy, this device, this drug is safe for human use or human consumption. Next, inside those clinical trials, we also have to prove that there's a measurable and statistically significant impact of utilizing this therapy, this treatment for this outcome that we were looking for inside of this disease process. With enough clinical trials, both on safety as well as efficacy, we can eventually have an approved indication this therapy can be used to treat this disease. First of all, what does off-label not mean? Off-label does not mean that this is an illegal, experimental, or dangerous procedure in any way, shape, or form. What it does mean is that we cannot utilize a marketing strategy that says, I'm using this therapy to treat this condition, because there's not enough evidence in this moment from clinical trials that draw a conclusion from applying this therapy to specific outcomes inside of this disease. That being said, medications are utilized off-label all the time inside of medicine. Let me share with you a well-known example of utilizing a drug off-label. In the 80s, Pfizer was producing a new cardiac drug. They were hoping that inside this cardiac drug, they'd be able to use this medication for the treatment of conditions like angina or pulmonary hypertension. This cardiac drug was a vasodilator. There were a few interesting notes throughout these clinical trials on this cardiac drug. Number one, it didn't have as great of an impact on some of these disease processes that other cardiac-related drugs had. After a number of clinical trials, it was certainly found that this cardiac drug was safe. There were no major or dangerous side effects. While this drug was found to be safe, it also was not found to be as powerful for conditions like angina or pulmonary hypertension as other drugs that already existed in the market. So from that standpoint, it just wasn't going to be one of those blockbuster drugs for Pfizer to release in the cardiac category of drugs. So while the cardiac benefits throughout this trial were moderate at best, there was one unexpected outcome, and that outcome was the male participants in this study didn't want to give their pills back. They found a totally separate benefit from taking this medication that, quite honestly, nobody expected. What medication was this? You can imagine, Viagra. And so Viagra started its journey in the 80s as a cardiac drug for vasodilation of blood flow to the heart, but it turns out its strongest impact was blood flow somewhere else. And as a result, Viagra was born, and after years of recommending Viagra off-label, Pfizer finally got their blockbuster drug, but not in the cardiac category, in the erectile dysfunction category. And you know where the story goes from here. So in this particular case, this medication was utilized for improved blood flow. It only had moderate impact in the location they were targeting. It had enormous impact in some other location. It was deemed safe and recommended off-label for many years, and eventually, through enough clinical trials, was found to be safe and effective for erectile dysfunction. And as a result, we have a new on-label use for Viagra. This is one example of tens of thousands of examples of utilizing an on-label therapy off-label. Hyperbaric is no different. When it comes to hyperbaric, we need to establish a level of safety. Hyperbaric has been utilized for decades and decades with a very, very strong safety record. Using the right equipment, being trained to operate that equipment properly, having appropriate policies and procedure, being compliant inside your hyperbaric practice will create an incredibly safe environment for patients to receive hyperbaric oxygen. Understanding absolute contraindications, understanding relative contraindications, and only recommending hyperbaric when it's appropriate based on mechanisms of action, utilizing mechanisms of action and your best clinical judgment, recommending hyperbaric oxygen off-label is completely appropriate. We have 15 FDA-approved indications here in the United States for hyperbaric oxygen. If we were to categorize what types of issues are FDA-approved, we can say very severe and life-threatening infections like necrotizing fasciitis or gaseous gangrene. We can say very severe wounds, non-healing wounds and burns, so significant tissue damage. Another category would be arterial insufficiencies, not being able to deliver enough blood flow and therefore not enough oxygen to a particular area to save that tissue. That could be true in certain types of vision loss. It could also be true in terms of radiation necrosis, or a new indication from last year, which is osteonecrosis of the femoral head. Another arterial insufficiency, not driving enough blood flow, not driving enough oxygen to a particular area and tissue, and now losing that tissue. It becomes necrotic and eventually dies from lack of blood flow. In almost all of the FDA-approved indications, these are life and limb conditions. We're about to die or have an amputation, lose our hearing, or lose our vision. And those are the types of conditions that are FDA approved for hospital or wound care clinics to utilize hyperbarics and to market hyperbarics for the direct treatment of these types of conditions. What we've done over the years, and in particular what I teach in my certification courses, is the mechanisms of action. We have decades of research and thousands of studies showing the safety of using hyperbaric oxygen, and these thousands of studies are helping us understand the mechanisms of action of what hyperbaric is actually doing from a physiological standpoint. If you become an expert in diagnosis and you're an expert in understanding the pathophysiology of whatever condition somebody is being challenged with, and you become an expert in the mechanisms of action of hyperbaric, your job would then to be utilize your clinical judgment and understand, would this therapy positively impact this pathophysiology? Will these mechanisms help to support physiology that is struggling in X, Y, or Z fashion? If the answer to that is no, then the recommendation should not be made. If the answer to that question is yes, then it's completely appropriate to recommend this therapy off-label for the support of a patient struggling with these particular issues or with these particular symptoms. And while I've addressed this conversation in so many other videos in the past, it seems appropriate to mention it again here. I often get asked, why would I need an FDA-approved chamber if I'm using my chamber to support patients with conditions that are not FDA-approved? And the reason is this: has your therapy been proven to be safe for human use or human consumption? Once the chamber itself has gone through the proper safety certifications and has met or exceeded the build-to specs of a hyperbaric chamber build, and therefore has been FDA approved for human use, we can therefore then say that the chamber itself is safe to be utilized with humans inside. If it has not gone through that process, if it is not FDA approved, if it is not meeting or exceeding the build-to specs of the American Society of Mechanical Engineers or the pressure vessels for human occupancy, those who govern the build-to specs, then we cannot say that that hyperbaric chamber is safe for human use. If you have a treatment therapy, drug or modality, and that drug or modality has not been deemed safe, well, then you cannot use that on-label or off-label, because the premise is that you haven't proven the safety of the treatment itself. If, however, the device you're using has met or exceeds those standards and the FDA has given you clearance for utilization of that device, now you can say my device has been proven safe, and as a result, you can choose to use this therapy on label to directly treat the 15 approved indications in the United States, or you can choose to use your clinical judgment, mastering the mechanisms of action, mastering the pathophysiology, and combining those two while using clinical judgment to make a call. Yes, this therapy should be safe, And for these particular reasons, I believe it would be effective for this particular patient to support these different pathways. But utilizing equipment that has not been approved is a non-starter in this entire conversation. FDA approval on a device or a drug is a completely different conversation than on-label or off-label use of that therapy or that drug. Utilizing an FDA-approved chamber for off-label use recklessly or without that clinical judgment is not something that I condone. If you feel like you know this information inside out and backwards and you're doing a great job creating your connection between mechanisms of action and pathophysiology, amazing. Good by you. And if you're not doing that, or if you're following protocols simply because you heard that might be effective, or you read it in a book, and you've not gotten the training necessary to feel confident and comfortable in that entire thought process, that's exactly what we teach in our hyperbaric certification programs. There's a baseline level of trust that a patient has when they seek care in your office. And there's a baseline level of information that you need to be prepared with when that patient comes in so that you can confidently recommend yes or no to the therapy, and if yes, what type of protocol would be required to meet their needs. If you're not that familiar or you're not that comfortable with those types of conversations, your next step is to absolutely get yourself certified, get that level of knowledge, fill that gap so that you can continue to practice hyperbarics as safely and effectively as possible. I appreciate your time and attention in this video. Thanks for taking this dive with me. I'll see you on the next one.